My name is Caffo. I'm a medical oncologist and I'm working in Trento in Italy. The CHEIRON study is the first phase 2 randomized trial comparing the standard treatment with chemotherapy as a first line for patients with metastatic castration-resistant prostate cancer. This was compared to the combination of the chemotherapy with enzalutamide, one of the new androgen receptor targeting agents. The patients received as a standard arm, the treatment was the standard dose of docetaxel, 75 milligrams of square meters every 3 weeks for 8 courses. The experimental arm was the same treatment plus enzalutamide at a standard dose of 160 milligrams daily for 24 weeks. The primary endpoint of the study was the rate of patients without progressive disease at the end of the treatment. And we plan to enroll 232 patients to have the possibility to target a 15% of difference in terms of primary endpoint between the two arms, with an 80% power and an alpha error of 0.10. We enrolled a total number of 246 patients, 120 patients received the experimental arm and 126 received the combination, the standard arm. The trial met its primary endpoint since we observed a rate of patients without progressive disease in 89% of the cases of the experimental arm and 73% of the standard arm. The difference was statistically significant, with a relative improvement of probability of response of 22%, corresponding to a number needed to treat of 6.19. Also, the median progression-free survival was in favor of experimental arm, since we observed a median progression-free survival of 10.1 months in combination arm compared to 9.1 months in the standard arm. The difference was statistically significant, with a reduction of risk of progression of 29%. No statistical significant differences were observed in terms of overall survival. The treatment was well tolerated, despite grade 3-4 toxicities in terms of neutropenia, febrile neutropenia, fatigue, and skin toxicities were more frequently observed in a combination arm compared to the docetaxel alone arm. I think that the combination of the treatment with the combination between chemotherapy and enzalutamide may provide a new possibility, a new strategy for patients who became resistant to the previous treatment with new hormonal agents. But I think that in the actual scenario of metastatic prostate cancer, this study provided a proof of concept concerning the possibility to combine chemotherapy with new androgen receptor targeting agents also in early stage of the disease. I think that the combination may be a possibility for patients with more aggressive disease, for example, patients with a very short time of disease control under androgen deprivation therapy. In our experience, we plan a strategy concerning the possibility to re-challenge with enzalutamide, the treatment with enzalutamide at the progression for the patients who have received the first line with docetaxel and enzalutamide, since enzalutamide was stopped at the end of the chemotherapy, so the patients have the possibility to receive again enzalutamide. We observed the possibility to have a new response or prolonged response for these patients. It's very difficult in this scenario to have the possibility to have a phase 3 trial to compare this agent with a standard treatment. But I think in the future may be the possibility to perform new trials in early stage of the disease, not in the setting of castration-resistant prostate cancer.